Welcome to All Clear Firefighter Wellness, where we seek ways to improve ourselves and those around us and light our fire within. I'm Travis. Welcome to All Clear. Good to have you back. Boy, we've got a special guest with us today. We've got Dr. Arthur Agatston. He is a very accomplished gentleman when it comes to the world of preventative medicine and such. And he's also done several things that you may have heard of. So I'm going to introduce Dr. Agatston, let him tell us about what he's done in his career and kind of lead us into our discussion today, where we're going to talk about healthy, sustainable eating.
Well, great to be with you, Travis. And Dr. Arthur Agatston, cardiologist, and developed early on an interest in preventive cardiology. When I grew up in the 50s, 60s, then the fear was losing parent, friend through heart attacks. And because of just also an interest in exercise, that all led to cardiology. And there really, when I first practiced, there was not much preventive cardiology at all. There was really not much we could do. And gradually learned more and more, a lot from Brent and Robert Superco, who I know you're familiar with.
Yes, good friends of the show.
And they taught me a lot about lipidologies, cholesterol, just total cholesterol, even your so-called bad cholesterol, the LDL, are not good predictors of heart disease. And when you break it down further into small LDL and large LDL, you get a much better idea. And so, I mean, one of the first things that was frustrating in the back to 1980s, when the statins came in, for the diet we were using, which was essentially the low fat, high carb diet recommended by the American Heart Association, did not work simply. It was the wrong diet. We now know a lot why. We can discuss how we came to the low fat, high carb and why it wasn't the right diet. And so we really weren't using diet as cardiologists. And if you went to a diet session at the American Heart meetings, there was almost nobody there. The nutritionists would say, count calories. And that we knew that didn't work. Along came the statin drugs. Controversial, they probably shouldn't be that controversial, but now you could lower cholesterol a great deal in people who need it. The question was, who should we lower it in? Because most people have heart attacks only have average cholesterols. Their cholesterols are really not higher than normal. And we became familiar with a new technology called the ultrafast CAT scan. It's a CT scan, like I'm sure many of the first responders have had. But it acquired an image much faster than were the earlier scanners. The regular scanner took a couple of seconds to acquire an image. So if you were shooting the brain or a bone that wasn't moving, you got a very nice picture. The heart was moving, so it was like you're shooting a racehorse with the slow shutter speed. You just got a blur.
Right.
So with this technology, it froze the motion of the heart. It was a sub-second acquisition. And so for the first time, we could see the heart not as a blur. And one of the things we could see was calcium within the coronary arteries. And it's the coronary arteries that supply the heart with muscle. And when they get blocked, muscle doesn't get the nutrients and the oxygen. And that's part of the heart dies. That's what a heart attack is. And so it turned out that the amount of calcium that we could see on this frozen picture of the heart and the coronary arteries reflected what we call the total atherosclerotic burden. Sounds complicated. It's how much plaque you have in your coronaries.
Right.
It turns out you don't have a heart attack until you're really full of plaque. You don't have a heart attack with your first plaque. So we realized that people with a lot of plaque were at higher risk, and those are the ones we should concentrate at that point to statin therapy, but now all of our approaches. And it turned out it was a very good predictor of the amount of plaque in the heart. So if you have no plaque, we call it a zero calcium score, you're really protected from a heart attack, depending what age you get it, how many years, but you're very low risk for the next 5-10 years of having a heart attack. And if you have a lot of plaque, you're at higher risk, and that's where we should be concentrating on our resources. And one of the other things we noticed when we were doing we developed what's called the calcium score. It's also named after me, the Agatston score. And so that told us how much plaque was there. And then the question was, what was the cause of the plaque? And it turned out a lot of people, particularly in diabetics, but also people who were overweight, had some lipid abnormalities, particularly their triglycerides, which are fat in your arteries, were there when in people who were overweight, and we knew the heart association diet didn't work. And at that point, Atkins had come out with low carb, really keto diet. We saw people who did very well, but at that point we didn't want to give heart patients saturated fat, and dairy, which we thought was dangerous. It turns out Atkins was right; it wasn't dangerous. But we sort of separated good fats and good carbs. So we honed down because of more information that was there, and we wrote a book, The South Beach Diet, which we thought might do well in South Florida, but it turns out to be a bestseller. And the main thing was people heading for diabetes or with diabetes, if they avoided sugar and bad carbohydrates, the fat just melted away. And so, and we also realized that one of the things with those patients with diabetes and what we now call pre-diabetes, that the reason their total cholesterol wasn't high, and often their cholesterol was actually low, because their cholesterol particles that ran in the bloodstream were very small, and their HDL was very low. So their total cholesterols were often lower than the average cholesterol, but they had a lot of plaque when we did the calcium score. And if you gave them a low-fat, high-carb diet, everything got worse. So that brought our interest in diet. As there's just been more advances with imaging and blood testing, and now we can test insulin levels. We could only start to test that in the 1970s, 80s, and there was really the Supercos and Dr. Ron Krause, who worked with the Supercos, who showed us the importance of looking for these small particles. And boy, were they right, because it turns out you can have a lot of very high cholesterol, but if they're in large particles, they don't get into the vessel wall, and it doesn't cause heart disease. So the small particles were really, really important. And we really now have an understanding of why people progress to have metabolic problems, particularly the belly fat. Anybody with a beer belly, we know has small LDL particles. Whether they're at meet criteria for diabetes or not, they're on their way to diabetes, and they start to get sick before they're ever actually diagnosed as diabetic. And most of the country, probably most firefighters, certainly after the age of 45, 50, are, are pre-diabetic and are at risk. Yet, when they just have a blood sugar or something that we use to measure called the hemoglobin A1C, that's your average blood sugar over 3 months, that's criteria for diabetes, but the problem happens before that. Anybody who had the beginnings of a beer belly will have fat in their liver, fat in their pancreas, and be on the way to heart attack, stroke, but other chronic diseases as well, including cancer and Alzheimer's and many other diseases. And we can talk about that because we're really just understanding that now.
It's interesting. You said so much in the last few words. Among firefighters, we know that the top reasons for death among firefighters it's not structure fires, it's not vehicle accidents, it's cardiac issues, it's cancer, and then there is a surprising long-term effects of things such as diabetes, and just a ton of issues that all grow out of, number one, the amount of stress that we face at work, the irregular sleep patterns for those that work 24-hour shifts, eating garbage, for lack of a better term, like a raccoon in a dumpster, as I like to say, because sometimes you just grab what's available. And all of that will come back to get you long term. And I know that it's interesting, professionally where I work, this SelectWell, the group that the Supercos have, they have done our blood testing for the last couple of years. And it's interesting when you have conversations with coworkers, they all know that, hey, things aren't as good as I thought they were. So you've definitely established that correlation between diet, the cardiac and the cancer and all those different issues we have. Now, with that being said, today, if you look on YouTube, it's carnivore, it's keto, there's 1,000 different diets, 1,000 different opinions. Everybody's got a different word. But the current thing among first responders, it seems to be pretty hot, is low GI foods and things like that. What are your opinion as far as all of these diets, the low GI? What do you think is a solid direction for first responders to move in if they want to last a long time, for lack of a better term? Today's episode is brought to you in part by Dash University, the leading training platform for public safety communications. Our 2026 Training Camp Summit is hitting cities across the U.S., bringing hands-on DAS and ERCES training straight to the field. Now, from Phoenix to Orlando, Seattle to Atlanta, you'll get real-world, code-driven training that prepares you for inspections, installations, and everything in between. You can learn more at dashuniversity.org and secure your spot today.
We'll return after these messages.
Are you enjoying this podcast? If so, we have a small favor to ask. Subscribing and donating helps us to keep the show running and brings you even more great content. By subscribing, you'll never miss an episode. You'll be able to support what you love. Donations, no matter how small, can help us cover production costs, improve the quality of each episode, and generally keep the lights on. So hit that subscribe button, and if you can, consider making a donation. Visit us at allclearpodcast.com to donate and catch up on past episodes and even read our blog. Thanks for listening and supporting our show.
And absolutely right. And by the way, we did learn, it was the studies performed by the Supercos that we realized how many first responders had high insulin levels. We'll get into insulin. And we're on the way to chronic disease. the GI, that stands for glycemic index, and that's how much of food will increase your blood sugar. And what we now know is when you increase your blood sugar, you increase your insulin level. Insulin is a hormone that is your energy storage hormone. And we have it particularly when our ancestors living in tribes are going through times of feast and famine. When there was food available, if you could eat more and store it in your belly, you were more likely to survive the famine. And the problem is when there's no famine, there's only feast, and the belly gets bigger and bigger, and the insulin levels stay high. That's when we get into trouble. One good way possibly to understand what's happened and how things have changed. We now have societies all over the world that have gone to what we call pre-industrialized diet. Before the Industrial Revolution came, it came first to the West. So often we say it's your diseases of the West, the diabetes, high blood pressure, heart disease, cancer, Alzheimer's. They were all considered diseases of the West. Now, as diseases throughout the world become more westernized, and that's throughout Africa and Asia, they get all the same diseases that we call Western diseases. They're now Eastern diseases. The examples I like to use is what two cities we know a lot about is Beijing and Mumbai. And if you visited Beijing in the 1970s, everybody was walking right around on bicycles and eating a couple meals a day. It was rice, but it was a whole grain type rice. It was absorbed slowly, a low glycemic index. It didn't raise your blood sugar or your insulin levels. Today, the amount of diabetes in Beijing and in Mumbai, the capital of India, is much or more diabetes than we have in the United States. And the amount of vascular disease as well, if you want to cheat coronary artery bypass, you can go to Mumbai. And what's changed is we sent them McDonald's, Kentucky Fried Chicken, and all the cars instead of bicycles, and all the pollution. So it's been called society transition. They've transitioned, and their genetics have not changed. They have the same genes they had in the 1970s, but now they have heart disease, they have diabetes, like same Alzheimer's, and cancers, and even in the United States now, we're having epidemic colon cancer in young kids.
Absolutely.
Young adults, I should say.
Sure.
And the reason is because with the junk they're eating, they have high insulin levels, the growth factor, and that makes cancer cells that wouldn't otherwise grow into cancers. And again, you don't, same thing in Beijing. There was not colon cancer 50 years ago. There is today. So we realized what we thought was first, heart attack, vascular disease, stroke, then diabetes. It's all the chronic diseases of the West. And we're not aging well. And you see it with the kids and all the data. And so any teenager you see with a belly already has fat, not just in their belly, but in their liver, in their pancreas. And if you measure their insulin levels, they're very high. They won't have diabetes yet often. Some of them do. But the high insulin levels, they bring glucose into the organs and store it and store the glucose there. A lot is fat, but the glucose, you don't have a high blood sugar yet. But if you measure insulin levels, it's already high, and the high insulin levels are causing arteriosclerosis. It's causing coronary artery disease. It's also causing high blood pressure, and particularly, for firefighters, where blood pressure has always been a big issue.
For sure.
We always thought that blood pressure, we called it essential hypertension, essential high blood pressure, meaning we didn't know what caused. We know what causes it. It's caused by high insulin levels that cause retention of salt and depressing a hormone called nitric oxide, which you hear about that on TV. That relaxes your blood vessels.
Right.
So, and when you go on a low carb, low glycemic index, you bring down your blood pressure sometimes very quickly. And there's something called the keto flu, called the Atkins flu,
Right.
where if you start a low carb, low sugar diet, in a number of days, you feel very weak. And they thought, well, not a good diet for you. You're getting weak. Try a different diet. What we know today is it's actually because you're responding very well to the diet, and without having the sugar and the bad carbs raising your insulin levels, it falls quickly. You get rid of a lot of sodium and you get rid of a lot of water. So you lose water weight early. We've always known early weight loss, a lot of it is water weight. Now we know why. And when the insulin levels go down, you increase nitric oxide, which also lowers your blood pressure. So what happens to these people with the so-called keto flu is they're dehydrated. They lost a lot of water. Their blood pressure is lower. They feel horrible. All you do is give them salt, electrolytes, and they're better really immediately. We didn't understand that just a few years ago. And so that's one thing that if firefighters, you go on a good low-carb diet that's getting rid of what we call the processed carbohydrates. That's the white stuff. That's both the sugar and the white bread, white pasta, white rice also. If you have a true whole grain or long grain rice, whole grain bread, that's much better. But most of our carbs are the white stuff, and then sugar is the worst. Now, one funny thing here is when we first learned about glycemic index, again, how fast a food like white bread raises your glucose, white bread was the standard. It would raise your the glucose to something like 100, and that was the glycemic index of white bread. And table sugar didn't have as high a glycemic index. So I used to say, if you're on the South Beach diet, white bread is even worse than table sugar. I was wrong. The thing is, white bread is chains of glucose molecules. It's broken down very quickly in your bloodstream, and the glucose gets in the bloodstream, and you measure it. So your glucose is high. Table sugar, as well as the sugar in high fructose corn syrup, anything with the sweet in fruits, fructose is what's sweet. Straight glucose doesn't, like white bread, it doesn't taste as sweet as if you have table sugar. And it turns out the fructose all goes to your liver. It doesn't get into your bloodstream, so it doesn't raise your blood glucose as fast. So what sugar, table sugar, all the sweets for dinner that have regular sugar, if it's sweet, it has sugar, or sugar substitutes is a separate issue. But that is worse than than white bread. And we didn't understand that till recently. That goes to your liver, the excess turns into fat in your liver, and that is what causes eventually diabetes and high insulin levels, all the chronic diseases. Does that make some sense?
Absolutely. But since we know all these things can happen to us, give us some good news. Can we reverse some of the damage that's been done?
Yes, absolutely. And both even early diabetes, when you measure, which we learned this again from the Schuperkos and Dr. Ron Krauss, insulin levels, your insulin level will be high when your blood sugar is still normal. So getting screened for insulin levels is really important, not just your blood sugar.
Right.
If the insulin level is high, again, if you have a belly, your insulin levels are going to be high. You don't even really have to measure it. And at that point, if you avoid sugar and the white stuff, the white carbs, and it's all the crackers, it's all the stuff we kind of know are bad.
Right.
Well, all the new foods. And by the way, when I first getting interested in diet, and I thought I'm going to be really good, I'm going to be low fat. And that's when in the era Entenmann's and
right.
that was my favorite. And there was like a Malamar. It was it was 0 fat, 0 cholesterol, but 9 grams of sugar, which was actually high fructose corn syrup. So
Right.
I thought I'm good. I'm low fat, and meanwhile I was getting fatter and fatter.
Mm-hmm.
And so that's one of the important things that we've learned. And often the high fructose corn syrup is hidden. But if you avoid the sugar and the white stuff, the processed carbohydrates, you can totally reverse the prediabetes and diabetes, and your energy level will go up. It reduces anxiety. There's a whole new area of study called nutritional psychiatry.
Right.
And again, we just learned about this recently, but we've seen people with panic attacks, depression, anxiety. In kids, it may be a lot of screen time, whatever. Most of it is the sugar.
Mm-hmm.
We actually did a study in school kids, and all the teachers talked about the sugar high the kids would get. They'd have a bad lunch, they'd come to class, they'd be bouncing off the walls, and then they'd fall asleep. Mm-hmm. This was because of high sugar levels. We went into the schools and we changed the food in the cafeteria, and their behavior improved and actually did better on their standardized tests. So the good diet, and one of the reasons I'm an admitted cheater, I'm a chocoholic, I'm addicted to carbs. If I started
no
on
harm.
stuff, when I'm good, I feel much better psychologically, energy-wise, mm-hmm. and more than preventing a heart attack 10 or 20 years from now, I do the good diet because I know I feel better. And so that's very important for first responders who are under a lot of stress.
Right.
And there's certainly a lot about the shift hours, not enough sleep, which, by the way, the not enough sleep also contributes to the high insulin levels. We mm-hmm. know it's all the same thing. So relaxation, exercise is all important, but eating the right foods, low glycemic index, low sugar, you will feel better, both and feel less anxiety and less stress.
Well, I know one of the things that kind of goes hand in hand with that. I've got one of our regular guests, Dr. Jill Joyce. She's a tactical nutritionist out at Oklahoma State, and her big thing is put the junk food away, make it hard to get to. Put some healthy fruits on the counter, things that when people walk by they tend to grab. If they want the cookies, they're going to have to go in the cabinet. They're going to have to find it. So sometimes just convenience hurts us more than we can ever realize. But, I think you've really given us some good insight as far as how important diet is. So if you could sum it up in, say, 3 points, what would you say are the most critical things that we as first responders need to look at to be
Well,
healthy for a long time?
yep. Now, one of the things I will say, particularly to first responders, meat is not bad for you. It raises your total cholesterol, but not those small particles that the Supercos taught us about. And so you can eat meat, hamburgers without the bun, and fish and chicken, and it does not have to be low fat. Fat is not your enemy. Carbs and sugar is your enemy.
Mm-hmm.
You can, and whether you're low carb, Atkins, South Beach, paleo, um, the keto, it's all healthy. And the more you get rid of the sugar and the carbs, the better. You can be healthy on a plant-based diet. It's much tougher.
Mm-hmm.
And overall, you're missing nutrients. I think what we call the carnivore diet based on meat is actually the healthiest diet and the easiest way to really avoid the sugar and processed carbs. Then you get all the nutrients you need from the meat, believe it or not. That's how our ancestors, who were primarily meat eaters, and
Sure.
in the 1800s in the United States, the colonialists, it was all meat and dairy. So number one. Number two is regular exercise. Now, exercise actually helps your insulin work. Because insulin sensitivity, you clear after a meal. If you take a walk, it helps you clear the sugar out of your bloodstream, and you don't get the insulin going up and giving you high blood pressure, and the rest. And the other thing about the exercise, we realize resistance exercise
Mm-hmm.
with some weight, some machines. You can do it at home with bands, or in a fire station with bands or whatever exercise equipment you have. Really, 15 minutes twice a week for big muscle groups, it increases the size of your fight and flight, which is called your fast twitch fibers,
Right.
the big muscle fibers, and it helps them store more carbs in the form of glycogen, which is safe storage. If you have smaller muscles, you don't have room to store glucose as starch as glycogen. It turns to fat, and that brings on the diabetes. So resistance training is as good or more important than aerobic. For the aerobic, doing intervals, if you're on a treadmill, elliptical, whatever, doing 30 seconds fast, 30 seconds or a minute, more a steady state. Interval exercise and resistance exercise, and you don't have to exercise 6-7 days a week. A little walking is good every day,
For sure.
but you don't have to push it. And some people do overtrain.
I think you have said more in those 3 points. I think there are so many firefighters that are listening to this right now that are nodding their head like I am, because we've been taught, sir, you've got to work out every day. You've got to do all these things. And it is important to keep our skills sharp. But when you start talking about, gaining muscle mass and things like that, there's a lot of fallacy to that. And I really appreciate you taking time to break all that down for us today. So, again, Dr. Agatston, thank you so much for just revealing this stuff to us. And at some point, we'd love to have you back because there are so many things I think we could learn from you. And really appreciate you taking time to talk directly to first responders. We can always benefit from learning stuff from knowledgeable folks like y'all. So
And
I
I
do
do want to
appreciate
say
it.
it's so much my honor to speak to first responders. So grateful for what what you guys do, and happy to speak to you again anytime.
Absolutely. Well, Doc, the thing that we always close out with, I think you may find some appropriateness in this. Whenever we sign off here on the All Clear podcast, we always say, "Light your fire within." So, thank you again, Doc. That's a wrap for this episode of All Clear Firefighter Wellness. Your host and producer, Travis McGaha, thanks you for tuning in. Remember, the views and opinions shared by our guests may not always reflect those of the host or the team, but we're all here to spark important conversations for firefighter health and wellness. All Clear is proudly supported by the North Carolina Firefighter Cancer and Wellness Alliance. If you enjoyed the show, share it with your crew or someone who needs to hear it. Head over to allclearpodcast.com to leave us a message, catch up on past episodes, or treat yourself to our signature All Clear Blend coffee, your new morning hero in a cup. Thanks for listening, stay safe out there, and we'll catch you next time on All Clear Firefighter Wellness.